Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Muhamad Aly Rifai. He is a psychiatrist and internal medicine physician. Today's Kevin MD article is The Rise and Fall of Telepsychiatry. Muhammad, welcome back to the show.
Thank you for having me to talk about a important topic, telehealth and telepsychiatry.
All right, tell us what this article is about for those who didn't get a chance to read it.
So I am talking about the field of telehealth and telepsychiatry. I've been involved with telehealth and telepsychiatry since 2006. I started one of the nation's first emergency telehealth telepsychiatry program at a local hospital in Pennsylvania, connecting three emergency rooms together to process patients who were being boarded in the emergency room. This was one of the early days of telehealth. The equipment was not as nice as we have them today. We started with equipment from companies where the size of the equipment is 500 pounds and it connects three different emergency rooms. The screens were bulky and it was different days. The quality of the connection was choppy, but we made it do. We were able to see and evaluate patients who were in different emergency rooms waiting for disposition. This program actually gave rise also in that health system to the inception of tele-ICU. And I assisted in the inception of a tele-ICU system where, like now, most hospitals have a centralized tele unit where physicians are in a centralized unit and they're able to assess and monitor and treat patients in different intensive care units and have a great impact on their course in the hospital. Same thing with telepsychiatry. We basically disposition patients who were waiting in the emergency room. We either decided on making an admission, or we decided that they could be managed on an outpatient basis, or we actually adjusted their medications. So it was pretty impactful at that time.
All right, so tell us about what the role of telepsychiatry is over the years. How has it evolved, especially during the pandemic? Whenever I talk to behavioral health specialists like yourself, people always say that there is a shortage of clinicians, and telepsychiatry is one of the ways where we could increase access. So tell me about the evolution of telepsychiatry since you first became involved with it back in 2006.
Sure, sure. So I think with the shortage of psychiatrists, the shortage of physicians in rural area, Congress was wise to actually enact some legislation that allowed the Center for Medicare Services to actually agree to have some services provided to individuals who live in shortage areas, in rural areas, that psychiatric services could be provided and would be paid for by Medicare if they were provided by telehealth. This started in 2009 in Pennsylvania. Also, Medicaid agreed to pay for telehealth services because most of Pennsylvania are rural areas, and we were able to get paid for telehealth services during those periods if somebody lived in an underserved area. Underserved area means less physicians, less psychiatrists.
Mhm.
The majority of Americans live in areas where the available number of psychiatrists only meets about 30% of the psychiatric needs in that area. This is for the majority of the 350 million Americans, they get only about 30% of what's needed in terms of psychiatric resources. So doing telehealth allows complex cases to tap into psychiatrists who
Yeah.
are not in rural areas. Also, psychiatrists could provide consultation services to primary care doctors in rural areas where they're actually able to provide consultations on difficult cases
Hmm.
and be able to manage patients who are in need of psychiatric services that way.
And tell us some of the challenges you face while doing telepsychiatry, especially to patients in rural areas. Was it difficult for you to do?
It was very difficult. We started initially actually with providing services to individuals who are in rural nursing homes. So we had the logistical support of the staff of the nursing homes, and these are mostly individuals who are severely mentally ill, who have a lot of psychiatric issues, and are residents of nursing homes. And that actually created a significant positive impact because it reduced the utilization of antipsychotic medications that
Right.
were very heavily being used in nursing homes, as well as the utilization of other medications, psychotropic medications. And it reduced the frequency of psychiatric hospitalization. We also connected with primary care practices that were seeing these patients with severe psychiatric illness and the significant burden that
Mm,
that imposed on primary care doctors. So we assisted those physicians. Now, there were significant challenges. The regulatory challenges, the billing rules were not clear,
mm,
the guidelines were not clear, and basically the government, in its usual pattern of different government bodies fighting with each other. For example, the Drug Enforcement Agency passed something called the Ryan-Haidt Act, which basically prevented the prescription of controlled substances through the internet, which by fiat was telehealth until the COVID pandemic happens and they waived the implementation of the Ryan-Haidt Act. But the Ryan-Haidt Act was passed in 2008, and from 2008 to 2020, the Drug Enforcement Agency never had guidelines or rules about the implementation of this law. They had promised that they're going to do guidelines and rules, and in 12 years, nothing happened. So it was just unclear implementation. So there were significant obstacles, especially in terms of Medicare, the billing rules, the billing
mm.
guidelines, and with all of the flexibilities that happened with COVID, many of those rules were significantly relaxed.
So, what's the current state today? COVID has become endemic now. Where are we in terms of the suspension of the regulations? Where are we with the Ryan Haidt Act today at the beginning of 2025?
So, in beginning of 2025, the Ryan-Haidt Act is still a law on the book. The Drug Enforcement Agency has decided to extend the suspension of the implementation of the Ryan-Haidt Act until the end of 2025. In terms of the flexibilities that Medicare implemented during the time of COVID, that loosening of the implementation and allowing some flexibility was going to expire on December 31st, 2024. Congress, at the last moment, gave a 90-day extension. So we're operating now, January 2025. We're operating on a 90-day extension till March, the end of March 2025. We don't know what's going to happen afterwards. Is Congress going to, the new Congress, is it going to write into the law that these flexibilities are going to be permanent? Medicare cannot do anything until Congress acts. And so we're in a period where anytime Medicare could come back and say, these flexibilities are done, and everybody goes back to seeing patients in the office, no more telehealth, except for individuals who live in rural areas. That's where telehealth would be allowed.
So, it sounds like that the clarity or the lack of clarity regarding the regulations can really hamstring the growth and spread of telepsychiatry.
Absolutely. I mean, there are companies that were founded in the times of COVID where they only saw patients by telehealth. What's going to happen now if come March the Congress says, well, we can't agree on what are we going to do, and all of the telehealth flexibilities are gone, and we go back to seeing patients in the office. All of these companies that were providing services to people that are out there through telehealth, all of these services are going to be going away. So it's a urgent situation that the Congress acts in terms of extending these flexibilities, but this all comes with a significant burden on practices. I personally have been at the brunt end of the regulatory issues, and I was on the end of a federal prosecution related to telehealth issues. I prevailed and I was found not guilty, but I could attest that there is very little understanding of these complex issues, and we need help with Congress acting to extend these flexibilities.
So, as one of the pioneers when it comes to telepsychiatry, in your ideal world, what would you like to see happen?
I think that there is room for extending the flexibilities and having most visits be available by telehealth for doctors seeing patients. understanding that there are patients that actually need to be seen in the office. There are patients where you need to lay hands on them, examine them physically. We know that for those patients, telehealth is not effective and it's not appropriate. I always also like to see the patient in person for the first visit because having that personal contact,
Mhm.
I think, is very, very helpful. Even if you're going to continue after that to see patients through telehealth, I think a first visit person to person would be very, very helpful in understanding who this person is and then being able to serve them much better and have a better diagnostic approach to that patient. There's been also a lot of new tools that are being available for us as psychiatrists. So, artificial intelligence, for example, with video conferencing. I am working on some artificial intelligence tools, for example, with us psychiatrists to examine the facial features of a patient to ascertain whether there is the presence of anxiety, mood issues, whether there's any movement disorders as a side effect to the medications that we use. There are some artificial intelligence tools that are being validated that would correlate the facial features with the severity of depression and
Mhm.
anxiety, or actually just the sound, the voice with volume and intonations. There's some artificial intelligence tools that would tell you whether a person is in distress or not and would actually assign a value for depression scores and anxiety score just based on the pattern of your speech. So the telehealth is here to stay. We have to be very cognizant about the appropriateness of each patient to do telehealth versus an in-person visit. And I think an expansion for telehealth services would be very, very helpful for our patients, would be very helpful for the health system, understanding that we have to choose the right patient.
I had a guest on a few weeks ago which talked about this exact issue, except from the patient perspective. Now, for those listening to you on this show and wants to extend some of these regulatory pauses when it comes to telehealth and telepsychiatry, what are some things that they can do to try and make that difference?
I think just advocating and talking to their patients. We need our patients to advocate. We need our patients to write for Congress. I think it is a very positive thing that we're going to have a fellow physician, Dr. Mehmet Oz, who's going to be the administrator for the Center for Medicare Services. So he, as a physician, understands what we go through and probably would be a great advocate for the continuation of these flexibilities. But we need Congress to act to extend these flexibilities. It has to be enshrined in a law that will make these changes permanent, especially also the prescribing of controlled substances through telehealth also. That
Mhm.
is a topic that's going to basically we're going to be faced with the same situation at the end of 2025 where there's no clarity. We don't have any permanent laws. So Congress has a big job to do, and our patients need to write to their elected representative to actually codify these changes as laws.
We're talking to Muhamad Ali Rifai. He's an internal medicine physician and psychiatrist. Today's KevinMD article is The Rise and Fall of Telepsychiatry. Muhammad, as always, let's end with some take home messages that you want to leave with the KevinMD audience.
Telehealth is here to stay. Our patients are demanding it. Physicians feel that it's an appropriate assessment and treatment modality for their patients as long as the appropriate patient is selected for telehealth encounters. Patients find that it's very, very helpful to them and want it to stay. I encourage all physicians and patients to write to their elected representatives so we could have permanent changes in terms of implementation of telehealth in our healthcare system.
Muhammad, thank you so much for sharing your perspective and insight. And thanks again for coming back on the show.